Good evening, everyone. My name is Mela from Radies in South Africa. We're going to start shortly in a minute or two. We just want to let everyone come in, and whoever is in the lobby, admit them in. Then as soon as we see a constant number, we'll start the meeting. So if you don't have your glass of water or a cup of tea or a cup of coffee, this is your last chance to quickly grab one, and we'll start soon. Okay, I think we can start. For those that have just joined, my name is Mela, and I am from Radies in South Africa. I'm a communications and online memberships manager. Um, Today we are having a webinar under community management or community engagement called Medical Aid Madness. Are your benefits spinning you out? And our speaker today is our lovely Elindi, who also happens to be one of our patients. Um, so yes, please introduce yourself, Elindi, to the rest of our attendees. If you have any questions, just some housekeeping rules. If you have any questions, please pop them on our Q&A tab. Ellen will try to go through all of them at the end of the presentation. If you'd like to say something, please raise your hand. Don't just unmute, just to avoid disruption within the presentation. And also, please note the webinar is recorded. So if you live the recording, even though it's going to be automatically sent to everyone, probably after an hour or tomorrow, please notify me if you don't receive it by 9 in the morning tomorrow. Okay, I'll hand it over to you, Elindi. The floor is all yours.
Wonderful. Hi, everyone. Welcome to all our fellow rare disease patients. It's nice to be here with you all. Thank you for Rare Disease for giving us this platform to learn all about medical aid, because it can cause a lot of stress for us as rare disease patients. Welcome also to the caregivers and the families. Without you, we can't do this. And then I've seen that there are a few doctors and practitioners on tonight as well. So welcome to you guys as well. It's nice to see you. So right, let's delve in. If we can, just leave questions to the end, just so that we can get through the presentation. But you're welcome, as Mela said, just to pop them in the Q&A in the meantime for us. And then we'll go, and then we'll get right started. So Are your benefits burning you out? What are we going to deal with tonight? I'm going to quickly touch on prescribed minimum benefits. I'm going to talk a little bit about chronic benefits. What's the difference also between your PMB and your chronic? I'm going to talk ER versus hospital, medical aid plans, know your benefits, the national health, and then some questions. So maybe just some background as to why we're doing this. So as a rare disease patient and being on so many of our support groups, it became very clear that a lot of us are struggling with understanding our medical aids. So a little bit of background on me is I used to be in the industry. So I used to give advice to clients. I'm not in the industry anymore. But due to the fact that I had a little bit to give, I felt a chance to give back to my fellow rare disease members and say, let's learn together and let's try and make life easier for all of us by just understanding how to get over certain hurdles. So there'll be a couple of tips. And if there's any of you that want to know more about this, please, we can definitely look at doing more in-depth stuff later. So let's go straight ahead. So prescribed minimum benefits, what is a PMB? A PMB is basically a benefit that is available to all South Africans. It is governed or legislated by the Council of Medical Schemes. And these are benefits that everyone should be able to get. It is a list of specific conditions, and those conditions, they've basically formulated like a package around what those conditions generally require and need. And every medical aid in South Africa has to give patients these benefits. So it is just one of those things that is there for everyone, and everyone gets the same minimum criteria. And then if you need anything more, you then have to apply. So where can I find the list? How can I find out if I don't already know, is my condition that I have a prescribed minimum benefit? So you can go directly to the Council of Medical Schemes. There's a little link at the bottom here for you. And you can click there and there is a list. You can type in your condition. You can type in an ICD-10 code. There's various ways of how to do it. Of course, you can also contact your medical aid. So they would also have this list. Your doctor would also know, or your practitioner. And there's various ways to find out but the easiest would be to go onto this list. Very importantly is you can't just get your PMB automatically. It is absolutely important that you get these codes from your doctors. So unless you've got an ICD-10 code in South Africa that basically speaks to your medical aid, and very importantly also, as you can see here, a procedure code, you don't necessarily, automatically get these benefits. You also have to apply to your medical aid to actually be on these benefits. So let's give an example. So let's say I see my psychologist and or my psychiatrist, and they diagnose me with major depression. Major depression is a prescribed minimum benefit. So therefore, I should be able to get a certain amount of psychologist visits or a certain amount of psychiatry visit. I should be able to get certain medications paid for. However, if I don't apply for these prescribed minimum benefits at my medical aid, they are just going to deduct these benefits from my savings. When you actually submit the form, which your doctor has to sign, then the medicine and the appointments or the treatment for that prescribed minimum benefit comes out of a completely different benefit on your medical aid, and that leaves your savings intact. So basically, tip number 1 is at the start of every year, you need to get a new form. Now, this is very important, guys. the medical aids basically don't just reuse the same forms every year. For some reason, they redate them. They almost look identical than the year before, but they do redate them. So you do need to get, for most of them, a new form every year. Then you need to get your practitioner or doctor to sign the form, fill it in, put on all the details, and you have to submit it. Once it's been approved, the medical aid will actually send you an email or a they don't mail anymore. So let's say email, and they will then give you what they call a formulary and a procedure list on what is actually approved. So let's again use major depression as an example. They might say that they have approved 12 sessions. That means you get one a month, for instance, or you can use all 12 sessions in one go. They might say for psychiatrists that they give 2 sessions a year. They might say that they only pay for these procedure codes. That doesn't mean that they're going to not pay for other stuff. It just means that outside of those benefits, you might have to apply again for it. Okay. So I've spoke about how to apply. Then where does the benefits come from? So we have major medical, we have savings, and we've got chronic on our medical aid. If we don't apply, then chronic and major medical won't fire. So the moment we don't apply, everything automatically just goes off your savings. So again, very important if you want to keep your money for what it's there for. What's also nice, specifically if you think about, again, mental health specifically, the medical aids have a specific benefit that is on the medical aid that is just for mental health. And they'll say, for instance, that you get 21 visits a year, or up to, let's say, 40,000 Rand a year worth of mental health benefits. So that is very important to say, I want to use that up first before I drain my savings. Then, is everything covered by PMB? We've touched on it briefly. Absolutely no. Guys, just because it's a PMB, don't automatically assume, very importantly, the surgery or the medication will be covered. There are limitations to what is allowed based on how the CMS has looked at what is required in general in South Africa, what is the need. And also remember, they look at stuff like cost benefit, they look at long-term benefits, they look at sustainability. So they can't just approve all types of stuff for PMB and then it will drain the medical aids and or public health services, and then there's no benefits left. So there is method behind why they have done it in this way. Right. Then a very important thing is there is a little word called seculi. I think I'm pronouncing that correctly. And this is a very unknown thing. And if there are doctors listening here, please take note. Please remember that if a condition is caused or so secondary to your PMB. So let's, for instance, I'm going to use a random example, but let's say I have a stroke, which is a PMB, and this leaves me, paralyzed. Any condition relating from that stroke would be a secondary condition, and that would be secondary to the PMB. So it has to be paid as per prescribed minimum benefits. And this is often overlooked. So guys, if you've got conditions that are not PMB and not chronic, but it was caused by your PMB condition, please ask your doctor to motivate for that to be paid under your PMB as well. Right, so chronic benefits. So very importantly, we need to distinguish here between PMB from a medical aid point of view and what is a chronic disease benefit, or as they would say, what is on the chronic disease list. So remember, you can have in my instance right now, I have a foot that's in a cast that is a PMB condition. It was caused by a dislocation that caused, torn ligaments, and therefore my ICD-10 code M24 is a PMB. But is it a chronic disease? No, absolutely not. I am going to heal from this. So what is chronic disease? What is on the chronic disease list? Well, we get up to 62 conditions that are generally covered by medical aids. Very importantly, they're not all covered the same way. So some plans might cover less, some plans might cover more. The higher you go on your medical aid spectrum, the more chronic diseases they will cover. But it is a list that generally looks the same across all the medical aid platforms, bar one or two. So a chronic a disease that's normally on your chronic disease list would be things like ADHD, anxiety, PTSD. I think acne might be on there. It might be one of your more rarer ones, though. Psoriasis is on there. So those are benefits that are not necessarily PMB benefits, but they are diseases that they want covered in a certain way. Again, where can I find this list? Very importantly, ask your medical aid. You can also, if you Google most medical aids, these lists are public. So go onto your medical aid's website and Google it. They generally will give you the list. Very importantly, these lists and how they are covered, like I said, might be different from provider. Every provider's protocols will also be different. So how they cover this disease, what medication, so the formulary that they cover will be different. So it's not just to say, okay, if I'm looking at getting a medical aid or moving to a medical aid, if medical aid A and B both cover psoriasis, doesn't mean they equal. You need to find out, if you have that condition, how do they cover it? Very importantly. So again, where do I get these codes? Your doctor gives it to you. What I didn't say in the previous slide is also remember that the invoice that you get from your doctor or the statement also has to have these ICD-10 codes and procedure codes on them, because that is how the medical aids know what to pay for. So it's very important also that these are correct from your doctors. Also, if you look at insurance later, if you've got an insurance claim, this is the type of stuff they'll look for. They'll try and look what is the ICD-10 codes that you've been claiming on for your medical aid. And that's how they will pay. They also work on a medical aid. So ask your doctor, look on your statements. How do I apply? Guys, again, so important. You cannot get cover for your chronic disease unless it is registered with your medical aid. Now, just because your disease or your condition is not on the chronic disease list doesn't mean that the medical aid won't necessarily help you. So it's always important to send it through. The worst thing they can do is say no. Does it mean they're not going to cover it? No, you still have savings. There's still scans, MRI scans, all these stuff, that there are other benefits on the medical aid that will get covered. But it's knowing how to get it covered in the best way. This will again come from your major medical benefit. Have you had it approved? And then out of your chronic disease benefit. So your chronic disease benefit also generally has a limit to it. So it generally has, they'll say they'll cover something for, let's say, 14,500 Rand a year, or up to a certain amount. And again, based on those formularies and stuff. So please, guys, you have to apply to make sure it doesn't just come off your savings. Is everything covered? I wish I could say yes, but no, absolutely not. Just because you register it, like I said before, My medical aid covers me up to 14,500 Rand for the year. So on one of my conditions. Is that enough? Absolutely no. So do I have out of pocket? Do I have co-payments? Yes, absolutely. But did I get that 14,500 first before it went off my savings? Absolutely. Did I make use of the Seguli on the PMB? Did I make use of my PMB? Did I make use of my mental health benefit? Absolutely. So that I could stretch that savings as far as I possibly could. So note that sometimes you have to apply more than once a year. So also look at the dates and the time frames, and sometimes they'll even say to you they need further information. So they will pay for 2 appointments, and thereafter they would need a report from your doctor, or they would need to see an x-ray. So read those documents, guys, that you get very carefully. A lot of the times things gets declined is because people didn't look at the detail. When you look at medical aids, the devil is in the detail. Sometimes multiple times a year for different benefits. It's not automatic. Always check, always ask. Guys, and then I cannot stress this enough. I attended a CMS, as a Council of Medical Schemes webinar the other day, and this came up all the time. One of the most regular reasons people don't get paid for authorized stuff, so going into medical surgery or a hospital, is because people didn't wait for their authorization to come through. So they went in for the operation, and then a day later the medical aid asked for more information and decline. Guys, always wait for your authorization to go through. Okay, and then important, know what your co-payment is for the stuff that you are covered for. One of the other very important things that comes up is ER versus hospital. This comes up all the time. My ER visit wasn't covered. Why? I've got hospital benefits. Guys, going to an ER is equivalent to going to a doctor or a specialist. Very important to know that. It is a medical practice or a doctor specialist practice inside a hospital that is open 24 hours. It is not a hospital. So in order for your ER visit to be covered, you need to see how many ER visits is covered by your medical aid, where it's covered from. Generally, it comes out of your savings. If you get admitted via that ER visit, they might move it to a hospitalized major medical, but that is very rarely the case. So be aware that there will be co-payments. That also means that any tests and stuff that they do there is not hospital test. It's not considered tests done in hospital. Blood tests, scans, all of that stuff. So it needs to also be authorized. When you are in an ER, you can't just go for an MRI scan without the hospital or the ER practice, my apologies, the ER practice actually authorizing it with the medical aid. That is very important. But again, remember your co-payments. Little trick of the trade here is gap cover. Guys, gap cover is so essential if you can afford it for us as rare disease patients. It helps because it also covers things like ER visits. The trick here, I'm probably going to be shot if one of the gap cover people listen to me here, but the trick is after 6 on a Friday is considered now they will pay for gap cover because doctors are closed. And then weekends, public holidays, and of course, if it's a medical emergency, you were in a car accident, that type of stuff. It's also important to distinguish on gap cover specifically and your ER visits when they will pay for illness versus injury. Injury generally is covered by gap cover on the ER quite well. Illness, on the other hand, becomes a bit tricky. That's where the whole after 6 on a Friday and weekends and stuff become more important. And children has different rules. So just remember, a hospital, it's normally you get admitted into the hospital to stay over or to be there half a day for a procedure. It has to be authorized, pre-authorized by your medical aid, unless, like I said, it is a medical emergency that has different rules. Right. So example of benefits, we've been talking a lot about benefits now, so I quickly want to just go through it. So this is an example of your major medical benefit, and this essentially would be your hospital, it would be your PMBs, it would be things like MRI benefits that you have pre-approved, it would be things like prosthesis, you get a cochlear implant, or you get a loop recorder, you get prosthesis. Very importantly, you'll see on this slide, and it's very small. So on the second, so if you look here, it says medical and surgically appliances in hospital. That word in is there for a reason. It's not just there by mistake. So they're not saying that you can get a stocking, compression stockings, and they'll pay for it out of your major medical. No. They will pay for stockings for your condition that was given to you in hospital. Okay, so very important to distinguish between those little nuances. So mental health I spoke about here as well. So this will be drug and alcohol rehabilitation. Again, this is being hospitalized in a medical facility, or very importantly, like I said, you have applied for your bipolar or your major depression, your PMB, and then it will also, as per what they have approved, go off your major medical. The next one would be your chronic and day-to-day. So day-to-day is your GP visits, your pharmacy, your specialist visits. That will all come out of your day-to-day. So that is, in most cases, your savings. Again, just to reiterate, have you applied for your chronic and your PMB? It most likely will not come out of your savings. It will come out of one of those benefits. So very important to note here is that you'll see that the chronic conditions here, there is a limit. So they will say per family. So this is not 12,400 for one person. This is for the entire family, which is very little. Okay, so important also for doctors to note this, that there is not a lot of benefits here. So making sure that we've got, the most effective medication, also per our medical aids formulary for us. Threshold is something on the higher plans. So some of the higher plans, once you've reached a certain amount, they'll say that if you as a member pay the following amount, which in this case for one principal member is 30,400 Rand. After that 30,400 Rand, then the benefits become, in essence, unlimited. And I put unlimited in inverted commas because it depends on which benefit in which section, and it becomes a little bit more complex. But it is worth it to look at if your out of pocket is a lot of money. Very, very important. You'll see I've highlighted state formulary here. Guys, one of the things that a lot of brokers don't tell their clients, but also that a lot of people don't know, is that whenever the word state and state formulary is on your medical aid benefit, so once you have taken up your medical aid, it will say on your statement that you are either an associated hospital or a network hospital, or you can go to any place, or it would say state. And sometimes it would just be state for your chronic benefits. Guys, this is very important. That means that you need to get your medication and your treatment at a state facility or a state hospital. That means that if you get cancer or you need to have your mental health treated or have dialysis, and you have that, there is an option or there is a chance that you could actually have to get this at a state hospital. There is in most instances a little line on the medical aids that say, should this not be able to be received at a state facility, then they would allow you to go to certain of the lower network hospitals and places. So just be very aware of that little thing there. And then I thought to do a case study about just how things can go wrong and how things, how the details matter. So I'm going to do a case on psoriatic arthritis and specifically the drug Humira, which is a biologic drug. So just quickly, psoriatic arthritis is very similar to rheumatoid arthritis. It's also an autoimmune disease. It is generally on the chronic disease list because this, psoriasis could be involved. So is Humira paid by most medical aids? Some yes, some no. Is it paid for psoriatic arthritis? Most of the time, you have an uphill battle. Should you have had rheumatoid arthritis? It's a PMB condition. So generally speaking, it could be covered. Some medical aids, I have seen little brackets creep in that will say, we cover rheumatoid arthritis, but in brackets, not biologic drugs. And they are allowed to do that. So does supplier A pay for the drug? In this instance, it was the patient's medical aid, and it is no. So the patient had exhausted all other medications, had gone through to the Rheumatological Society, been approved there. Doctor had showed that everything, disease is active. The client really, really needs this drug. We sent in everything for the client and medical aid came back and they said no. So why was it not covered? Was covered. The medical aid made it very clear to say, no, 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 we are paying for it. We're not saying you cannot have this, but we are declining it because it is a chronic disease. It's on the chronic disease list. Therefore, it is limited to that 12,400 Rand you saw, or in like my case, 14,500 Rand for the year. Humira costs about 6,000 Rand per injection. Okay, so that meant that for the first 2 months, it would basically be covered. After that, there would be no further funds. They also meant that there would be no further funds for anything else related to that chronic disease. So basically, the medical aid said, and they'll pay for it, but only for 2 months. That's all they can do. And so therefore, it's not covered. However, in this case, the doctor of the patient was insistent that medical aid B would pay for the drug and that it absolutely comes out of a special benefit and that the patient had to move because this is something they're going to have for the rest of their life. And if they're on this medical aid, they are covered. Thank goodness the patient in question didn't just move medical aids. Was the drug covered? Absolutely, yes, guys. It was drugged. Oh, it was drugged, sorry. It was covered. Was it covered in full? No. What does this mean? So, if you go look at the formulary for this medical aid on that benefit, it states that the drug is only covered up to 100% of the medical aid's rate. So that is like a trick question on an exam paper, because what is the medical aid's rate? We don't know. They don't tell us. I had to dig deep to help this patient to try and find it. It was emails back and forth and back and forth. Of course, the first line people that you get at the call center has no idea what you're talking about. They give you standard stock answers back. And the bottom line is it came out that it was only covered at 80% of the actual drugs cost. Now, here's the other thing is we would say, okay, but at least it's covered. It's only a small co-payment. No, hang on a second. On which plan is it covered? Turns out that I would have had to move my client one plan higher on the other medical aid, which happens to be the highest plan. It happened to be the most expensive plan on this medical aid, and then this drug would be covered. So what did we do? We looked at what the difference in cost was for the client to now move to the highest plan. That was already 1,500 Rand. Add in the co-payment, we ended up almost on 3,000 Rand. So now we're halfway to the cost of the drug. So now we can argue, okay, but, you know, we're on a higher plan, you know, drugs covered, so let's move. Hang on a second. Is it really? Because what else do I need? Do I just need this drug? In this patient's case, they also needed an occupational therapist, which they saw once a month. They saw a biokineticist 3 times a week. They saw an orthotist. They saw a chiropractor once a month. They saw a physiotherapist twice a week. They saw a psychologist once a month. They saw a music therapist once a week. And it added and added and added. If you look, this one that is on here, this is provider provider A, and they cover these allieds unlimited within the provisions of the scheme. So when we looked at all the rules of their current scheme, they were like, this is thousands of rands of benefits. We then did a cost analysis and we saw that this ended up being over 20,000 rands worth of benefits per month. We then went and looked at medical aid B and saw this little disclaimer saying up to 30,000 Rand a year. Now I ask you, is the client better off moving to medical aid B? This client is potentially out thousands and thousands of rands and potentially would have to stop 4 or 5 of their allies who help them function every day had they listened to their doctor. Then if you dug further, there's a little line that says, yes, you do have access to unlimited, but only if you apply for the benefit and at the scheme's discretion, should they deem it clinically appropriate, i.e. probably not. So it's here where I want to urge the doctors and providers online today to just be careful when you advise your patients to move to medical aids. Not only are there waiting periods, exclusions, and those type of stuff that we need to think about, but unless you know the very, very detailed nuances of every scheme, exactly how much your patient is spending on all of their various benefits, also on all the other conditions you are not treating them for. It is very dangerous to advise a patient which medical aid to take. This is really something that has to be done in an in-depth level with a financial advisor. And then I want to also say to the patients and the caregivers, your financial advisor has access to exactly the in-depth information that I am sharing today, and so much more. They have programs that can go in depth and figure this out. And they have business consultants that can get information for them from all of these medical aids. You have to, as a chronic patient and a rare disease patient, insist on these in-depth analysis. You are not the average patient out there. And I would want my advisor to do this no matter if I'm a chronic patient or a rare disease patient anyway. So based on what we just did, Medical aid B pays the biologic, medical aid does not. Does it mean the one is better than the other? No. We can clearly state or see that this is a patient-specific scenario. We have to always go back to what is my need, what do I need, what does my family need? And guys, very importantly, if you are multiple people in a family that have multiple different needs, there is absolutely nothing wrong by putting your family members on different medical aids. My husband and I, we are on separate medical aids. The reason being is he doesn't need a very expensive cover everything medical aid. And neither can most of us afford to have our families on that. I, on the other hand, do need more benefits than he does. So we have split our medical aid, and it's way more cost effective to do that. And we don't lose anything by doing that. So never be afraid to split your medical aid for that purpose either. So guys, what is your need? You have to calculate. Do you need allied practitioners? What is the cost of your medication? Is it PMB chronic or neither? What will the medical aid pay? How much of it will they pay? What is your medical aid plan cost versus another? What can you afford to pay out of pocket? You have to work that out. You know, medical aid season's coming up. Have a look at what you've paid this year. Take it to your broker. But guys, then very important, and this is where a little case study again comes up, is just because you move up a plan doesn't mean you are going to necessarily be covered for what you have paid out of pocket. You have to also look for the items. What was not paid? What did you have huge excesses on? For instance, things like casts, nurses, wound care, syringes, needles, those things most of the time don't get played by any plan, not even if you are on the best of the best of the best plan. Sometimes some of them will be covered again if you are applying for it, or if it's very specific to a very specific need or condition. But most of the times, consumables outside of hospitals, such as syringes, needles, bandages, that type of stuff will not be paid. So if your out of pocket is 5,000 Rand, but it's due to this type of stuff, going up a plan is going to be a waste of your money. So that's also very important. So in this case study, and I'm just going to talk through it, we had a client that had their family all on one plan. It was mainly a hospital plan. And that is all they needed for years. And they were very happy. We talked to them about higher plans, you know, dental, all of these things. But, you know, they were happy with where they were. Was on a good plan as well, no issues. The husband, unfortunately, ended up in a tragic car accident. Multiple car vehicles went over him. He was in a motorcycle. He was on the motorcycle and it went under cars, and it was horrible. Hospital was obviously covered, but needless to say, he needed so much more care out of hospital. He needed physio. He needed all these things after that his hospital plan didn't cover. They also didn't have a gap cover, so there was so many extra expenses that was related. Because remember, some doctors can charge, your medical aid might pay 100 or 200% of medical aid rate, but your doctor or specialist that see you might charge 600 or 700. Now that could mean that you need to pay in 400,000 Rand. An example of that would be, for instance, my foot surgery that I just had was exactly a case like that, where the doctor charged 700% out of medical aid rates. My medical aid only covered 200%. I was in for 60,000 Rand. Thank goodness for my gap cover, because they forked out every single cent. So I was okay. Most people don't have gap cover and then would have had to pay that 60,000 Rand, which was more than what the medical aid paid, and it was a PMB. So that just gives you an idea. So just back to this client. So we then did the analysis for them to see, would it be better for them to go up a plan. Now, unfortunately, they couldn't upgrade when the motorcycle happened, because you can only do that, you know, at the beginning of the year. And so it wasn't possible. So there were so many things out of pocket. But when we could upgrade for the next year, when we worked out, the cost at that point for him was nurse, wound care, it was bandages, it was co-payments on physios, it was all these type of stuff. And we worked out that going up a plan would not have actually covered the 5,000 Rand that they were actually paying per month. It would have worked them out roughly the same to go up to a higher plan, and they still would have had to fork out those same expenses. So always make sure what is your need, and if you are correctly covered. That is essentially what I'm saying there. Don't just jump, don't just make an assumption. So before you change plans, there's also a couple of other things that you need to keep in mind. You have to keep in mind waiting periods. General waiting periods, guys, if you move, you can get a 3-month general waiting period. Only PMBs are covered during this time. Condition-specific waiting periods, they can give you a 12-month waiting period. Generally, that doesn't happen if you move from one medical aid to the other, but they are allowed. Guys, things like exclusions, keep that always in mind. I'm also talking to people here who does not necessarily have a medical aid. So you can, if you've never been on a medical aid and you're older than, I think, 35, they can impose a late joiner penalty. You can get exclusions that are allowed to exclude you for a certain number of months. So please always remember that you need to, just check these things. Is it worth it? Is it worth the risk that you are taking? And then, guys, crucially, always, always fully disclose. Just because you're moving from one medical aid to another doesn't mean that you don't have to list everything. A lot of the time, medical aids also go back and say, oh, no, but you, according to your doctor, you've had this for years, but you never disclosed this. So sorry, we're not going to pay for this. They're even allowed to kick you off the medical aid. So please always be very diligent with, don't let anything out. Guys, know your benefits. So you have your medical aid now. What now? Read the protocols and formularies. Ask for it. The medical aid does not send it to you automatically. You absolutely have to ask for it. Make sure you authorize your chronics and PMBs. Make sure you know what is covered, how, and for your different conditions. See if there are overlap on your benefits for your non-PMBs, your chronics, etc. Guys, ask your doctors to use your PMB codes when asking for tests, prescribing medication. Often they don't write it on the script. You'll have a neurology appointment and they'll say your peripheral neuropathy is due to your autoimmune rheumatoid arthritis, but then they'll put neuropathy ICD-10 code on the script or the practice. No, tell them, okay, it's SECULI2 or SECULI2. Yes, put my neuropathy code there, but please also put my PMB code there. Please also put my chronic condition code there, because it is related. Then, guys, make sure on your scripts it's there. Very often the pharmacies will just do a generic when they load the script, they'll just put a generic ICD-10 code there because the doctor hasn't put it there. It makes a huge difference. I had it now recently in the last 2 weeks, where on the one script, the doctor forgot to put the ICD-10 code. I had to almost pay for the medicine in full. The following week, she put the ICD-10 code. I didn't pay a cent. It is very, very important to make sure your ICD-10 codes are on your scripts and correctly. Another example of, funnily enough, also happened to me recently is with the surgery I had the medical aid pay for my physician, but when the anaesthetist bill came through, they turned down the anaesthetist. And when we looked at the codes, the anaesthetist had the complete wrong procedure code on his statement. So we had ligament repair on the physician's code, and on his, it had a synovectomy. Now, this is two vastly different procedure codes, and it is just a clerical error, but it's highly important, and this delays payments. Guys, then I'm not going to touch on this long, and we're running out of time. I want to leave some time for questions. Basically, National Health Services, don't panic. Please, please, please don't panic. I urge you guys. Guys, there are so many legislation, laws, and stuff that has to be amended and passed. It's going to take years. It is very at its basic stages. There are also big agencies fighting the courts and making sure policies are amended, making sure that the legislation that has to pass is either not passed or passed in certain ways. You still need your medical aid. There is no tax amendments that has been made. Your employer can't just start deducting tax from you. SARS can't just start deducting tax from you. There's absolutely no tax laws that has been passed on this yet. This is going to be a phased approach over many years with many amendments. There is going to be trial and error. In essence, right now, only legislative documents have been passed as a framework for the NHI. There is no funds that has been established. There is nothing that is ready to be implemented. It is discussions. It is stuff that is being placed forward to practitioners, to different bills, to different parts in the country, to different unions. It is in a framework stage. So what does it mean for you as a patient? Nothing. It basically means stop panicking, stop worrying. It is at such a low stage of implementation that it's not even ready for you to have a discussion with your broker about it. They are going to tell you the same thing I have just told you. There is nothing for them to discuss. There is nothing concrete. Please breathe. Please don't panic. It is far off and a lot needs to happen. So there you go, guys. That was quick and a lot of words. I will now open it up for questions.
Lindy, there's one question from Kate. Are there medical aid advisors who can help us figure out how to get things covered and which plans and medical aids will be best for us?
Absolutely. Kate, that's a great question. So absolutely, there are many amazing ones out there. Of course, there are also some not so great ones out there. I am very happy to suggest some. I don't think I'm going to do it on this platform, but maybe Mela, we can pass it on to Kate offline. Guys, I think in this webinar, I've given you guys enough tools to know when you're speaking to a broker or your financial advisor, what to expect from them and what to ask. I would say, maybe don't go to the medical aid house directly, or to one of their direct brokers potentially, because they can only really brief you on their benefits. So if you do want a holistic idea, then go to someone that's independent. That would always be my advice when it comes to life insurance, medical aid. Go to your independent brokers because they get trained on multiple products. They have to do continuous professional development on all of these products. And they look at what's best for you as a client, not just the product that is in-house that they have to sell. So that would be my advice there.
Okay. Okay, I think that was the only question. If anyone wants to say something, please just raise your hand or unmute you. You can ask
Mela?
your question.
Sorry, there
Yes,
was another question in the Q&A. Let me just go. Someone asked, is it possible to be a PMB and a chronic at the same time?
Absolutely. So it won't be for the same condition. But yes, absolutely. One of them. So you can be on PMB benefits. You can also be on chronic benefits, and you can have benefits or you can have conditions that don't apply to either. So again, that is why it's so important to know how to work your benefits so that you know that your PMB condition, if you register it, that one won't go off your savings. Happy days, co-payments will go off your savings, or you'd have to pay it in, but at least that one's not going to take from it. Your chronic one will go off your major medical from your chronic condition. And then, depending on if you register something else, if you get special approval, that will also go off different benefits. And then the rest will go off your savings. Or if you have your threshold, like I mentioned before, if you then in your above threshold benefits, which they call it, where they then have to pay the stuff, then the rest will go off there.
Okay, thank you. There's also Unique. Sorry if I'm mispronouncing your name. You have your hand up. I'm just gonna quickly unmute you.
Hello.
Then you can ask your
Yes,
question.
I just wanted to find out very quickly, would we have access to this video recording afterwards just so that we can maybe take a little bit more notes? And if we needed to maybe chat to you, Lindy, or anybody, just maybe for a little bit more of, advice, would that be possible?
Absolutely. So Mela has said that they will make the recording available. And then I've moved over to another slide. So anyone is welcome to reach out to me at those contact details. And I am more than happy to connect you guys to good advisors in the industry. I've really had contact with so many over the various years that I was in the industry. So there's more than one company that I can recommend and people. And what's nice about dealing with someone in person is I would also know by speaking to you who would be a better fit potentially for you from a personality point of view, because I think with medical aid, that's also very important to know that you've got someone on the other side that also is caring and that, you will give that extra bit. So you're welcome to contact me. This is my NPC's details, and then I can take it from there with you guys.
Amazing. Cool. And we have Kendi as well. I think she wants
Hi
to
there.
ask.
Hi.
Hi. Sorry, I maybe missed it because I only joined halfway through. But in terms of PMBs, I just need to find out what exactly are medical aid liable to cover. Is it only the medication, or is it like consults everything with regards to that PMB?
Oh, that's a very good question. So, yes, absolutely. So it is not just medication. There will absolutely be what they call a formulary or protocol for the PMB. So what I would suggest you do is just email your medical aid and ask them for your protocols and formulary. You can also look normally at the beginning of the year when your PMB is registered. You will get an email back from them that has an attachment, and that generally speaking has some of the formulary and codes and stuff on. What we often find is that sometimes doctors don't stick within those codes, or they use a similar code or different code, but because it's not that specific code, then it doesn't get covered. So you can also take that to your doctor and say, doctor, is there any of these codes that maybe help us a little bit more? But guys, they're also very outdated. I looked at the arthritis one 2 days ago, and they only, for instance, cover x-rays for hands and feet. Now, if you don't have arthritis in your hands and feet, but you have it in your back and your hip and your, whatever, then it also makes things very difficult. So I hope that answers your question. So yes, it absolutely does cover other stuff, but within limits. So they'll say they'll cover your specialist twice a year, for instance.
Awesome. Thank you very much.
Pleasure.
And I think one last question, do PMB applications always get accepted? I've recently applied and I've been told that they're still coming to a conclusion. I think Kelly can also jump on this question as well.
Yeah. So let me take first, and then Kelly can continue. So PMB absolutely should be covered if it is obviously clinically correct. So they will most of the time ask the doctor to write information about it. Some are obviously a bit more difficult and so on, but generally speaking, unless there's a problem, it should be approved. But Kelly, I know you play in the space a lot more. So perhaps if you can give us some input case studies.
So essentially, the PMB as a condition, if it is a PMB and it is listed on the codes, it's listed on the list.
Yes.
The PMB will be accepted, no doubt that you will have your PMB registered, provided that you've got confirmation of a diagnosis. So
Yes.
your doctor would need to provide motivating evidence, clinical evidence to prove that you are in fact that you do in fact have that PMB condition. What doesn't always get covered is the request for the treatment plan. So the
Yes.
treatment benefits, your doctor might say, okay, he would like you to see a cardiologist 4 times a year, but the medical schemes as part of their formularies or as part of their clinical benefits have only allocated 2 a year. So there are certain benefits which have to be covered based on the diagnostic treatment pair provided by Council for Medical Schemes. But the PMB will always be accepted. It's not negotiable. Those are predetermined, they're legislated, and medical aids don't have the option to pick and choose. But
Yes.
what has been requested as a possible treatment pair might not necessarily be covered.
I think in that instance, it might be nice to talk to you offline to see how we can help, to see where the problem actually lies. Is it the PMB? Is it the treatment? Is there something else that perhaps was a problem? So feel free to reach out to us to see if we can see if there's maybe something else that is a problem and not the PMB itself.
Amazing. Okay, there's no other questions, and I don't see anything under our Q&A tab. If you have any questions or you remember anything after this webinar, you're more than welcome to also email me as well with your questions. And then I'll just forward them to Elindi. Yes. I think we're at the end of our webinar. Thank you so much. Thank you, Elindi, for hosting. Thank you also, Kelly, sharing your thoughts. Okay, I think there's a hand coming, or it was supposed to be a clap. Yeah, so I just wanted to thank everyone for just taking time off your beautiful Wednesday evening in Joburg. I don't know the other parts of South Africa. We really appreciate it for even giving us an hour out of your busy schedule. Some of you are perhaps busy with treatment, but they took time to just be part of this webinar. So I'd love to send our greatest thanks on that. Is there anything you just want to say, any closing remarks from your end, Lindy?
No, just absolutely. Thank you to everyone who joined, and thank you to Rare Disease for making a platform like this available for us to learn together and to ask questions. And yeah, thank you so much.
Oh, sorry. Well, until next time. Thank you so much. We'll keep in touch, Lindy. And again, if anyone has questions or whatever, please send me a WhatsApp or email me. and then we'll just continue with this conversation offline.
Absolutely.
Thank
And
you so
I also think if anyone wants more information, please let us know. We can always make something that's more in depth next time.
Mm-hmm.
Yeah.
True. Okay, good night, everyone. Take care.
Good night.
Bye.